Body Mechanic Bike Fit is a 3-step process that we work through to ensure we find the best possible position for you on the bike. These 3 steps are the internal elements, meaning your body geometry and how efficiently your body functions on the bike. Secondly, the external elements, which are your bike, as well as some of the lifestyle factors which can affect your cycling. And thirdly, training, how you structure your training and how that relates to your risk of injury. Firstly, let's discuss the internal elements. The first part of the Body Mechanic Bike Fit is to assess your body using a biomechanical screening process designed to test your body and identify any tight muscles or joints and any structural issues with your body or any underactive or lazy muscle groups. During the biomechanical screening, we also assess your body for any dysfunctions or injuries. We'll take these into account when fitting you on the bike. For example, someone with lower back pain may require the front of their bike to be set a little higher in a more upright and relaxed position, or someone with hip problems might need their saddle fitted higher to reduce hip impingement so they have a more open hip angle position while pedaling. Step 2 is the external elements of your fit, the most important of which is your bike. We need to make adjustments to your bike to ensure that it is both comfortable and efficient. We look at the 5 contact points you have with the bike, your 2 hands, your 2 feet and the saddle. For example, we can make adjustments to your cleats, your saddle height and position, your stem or bars to make you more comfortable and allow you to use your body more efficiently. A lot of cyclists put too much emphasis on stomping down on the pedals, and I'm sure you're all familiar with the feeling of sore and fatigued quads after a hard ride. During your fit, we'll identify if you're able to use your glute muscles properly. Gluteus maximus is the biggest muscle in the body, and to ride efficiently, you need to be able to use it to push down from the top of the pedal stroke. The other external factor to take into account during your fit is the type of work you do. Most jobs in our modern environment require far too many hours sitting at a desk. Our bodies aren't designed to sit for prolonged periods. Too much sitting can contribute to knee, hip and hamstring pain while you ride. If your desk-based job has shortened your hip flexors and making your glutes lazy, then we'll identify this during the biomechanical assessment and give you some easy stretches to work on that will help to sort out that problem. The final step in our 3-step bike fitting process is to discuss the way you structure your training. Our number 1 priority is for you to stay injury-free, and to do this we need you to understand how to structure your training and allow your body to safely adapt to the changes we've made on your bike position. Even in the theoretically perfect position, if you do too much riding too soon without giving your body a chance to adapt, then you will get injured. Every time you ride your bike, it causes trauma to your muscles, tendons and joints. If you ride an amount that is appropriate to your current level of strength and fitness, then this trauma is minimal and we call it micro-trauma. When you sleep at night, your body releases hormones that help to repair the traumatised tissue, and the end result is a stronger and more resilient body. The most common training error we see in the cyclists who come to the body mechanic is that they do more training and cause more tissue trauma than their body is capable of repairing. This overtraining process is what ultimately results in most, if not all, of the overuse injuries that we see and treat. Injuries like ITB friction syndrome, glute tendinopathies and chronic knee pain, for example. You need to get the balance right between the amount of training and resting to ensure that you have a positive tissue adaptation, where your body gradually gets stronger and can cope with more and more cycling or cycling at higher intensities for prolonged periods. Having changed your bike setup, your body is going to be subjected to slightly different forces than it has been used to, and as such, there's a risk of creating a new injury if you immediately go out and ride too much or too hard for too long. For the first couple of weeks especially, we recommend the little and often approach. What this means is relatively short but frequent rides. For example, if you're currently riding 200 Ks a week, it's easier on your body if you spread those 200 Ks up over 5 or 6 rides of roughly equal distance. This is the micro-trauma and quick recovery we were talking about earlier. The hardest way for your body to cope with the same 200 Ks would be to adopt a typical weekend warrior approach and cram that 200 Ks into 2 days over the weekend. So there you have it. The principles and reasoning behind why we do what we do, and the end result will have you in a more comfortable, efficient and sustainable riding position to thrive during the multi-day Can4Cancer ride. You'll leave the bike fit with some specific exercises to help your body adapt to the new position and with the knowledge of how to structure your training to minimise the risk of sustaining any injuries. We really look forward to working with you during your bike fit and riding with you during your Can4Cancer tour.